Next, obviously, now we're going to be getting into some things that are not so sleep related, but are very important when it comes to getting a good night's sleep. Okay, so obviously, depending on your child's sensory needs, you do have to factor this in, and you do have to make certain changes so that you know your child is getting really the best chance to have a good night's rest. Okay, so in the case of kids with poor vision, obviously, if you can't perceive light and dark the way you should, this is going to affect the body's wake and sleep time. One of my very first clients that I worked with was a blind, immobile 18-month-old. Her body clock was all over the place. She would sleep all day. She'd wake up at 2 a.m. They'd do the bedtime routine. She'd sleep until 10. It was all over the place. Okay? And that's because she could not see properly. She was blind. And if you can't perceive that light coming in during the day, it's going to be harder for you to stay up. If you can't perceive dark as well as you should, it's going to make it harder for you to go to sleep. So you have to give your child stimulation. You have to teach the brain what light and what dark means. And you're going to teach your child that light means awake, dark means sleep. So as much as possible throughout the day, you want to make that contrast as big and as wide as you can. Now, one very simple thing that you can do is you can do a little bit of light reflex stimulation. So your eye, there's a little black dot in the middle called the pupil. And when it's dark, the pupil gets bigger. When it's light, the pupil gets smaller. This is the light reflex. So what you can do is a few times a day, you take your child into a room where there's not a lot of outside light influence. You turn the lights off for a few seconds, and then you turn them back on. Turn them off, turn them back on. Turn them off, turn them back on. Okay? So that is providing the brain its first information when it comes to contrast. And by the way, do an auditory cue as well. Teach your child, when the lights are on, you're awake. When the lights are off, we sleep. Now, you can also give your child big, bright, bold images to look at as well. And I'll add a link here so that you can access just some really great books and some materials to show your child big, bright, bold images and make that contrast as great as you can. Now, before I move on to the next thing, this last point is for everybody who is attending this lecture right now. And that is that you want to make sure your child's room is dark, 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 dark for sleep. Okay? For some kids who have poor vision, you want to make it very clear, dark is for sleeping. Any light influence that's coming in is going to confuse that message. Now, there are some kids who are hypersensitive when it comes to sensory things, and that includes vision. So if your child tends to be overly sensitive, even a little bit of light influence coming into the room can throw off their sleep. So when I say dark, I really mean dark. If you're in your child's room and you can still see your hand extended in front of you, it's not dark enough. Okay, so make sure your child's room is nice and dark. Now, in the case of kids who have poor hearing, and I really mean at this point kids who are hypersensitive to sounds, so kids who hear things way too easily than you and I. As you can imagine, this could make things pretty difficult when it comes to going to sleep at night, right? If you can hear the laundry downstairs, you can hear the refrigerator running, you can hear mom having a conversation 2 doors down, it's going to be very difficult to go to sleep. And for a lot of kids who are hypersensitive to sounds, that is what they experience every single night. So the best thing and the easiest thing to do is to occlude the pathway. And what I mean by this is that you want to actually close off the auditory pathway to keep from all of those sounds coming in. So one very simple thing that you can do is use earplugs. And I recommend these Max earplugs because they're comfortable, they can mold to the shape of your child's ear, And it doesn't go into the ear canal. It just sits right on top to block out sounds. So there you go. We have those Max earplugs, and that's how they look. They sit on the ear canal like that. Now, one thing you could consider is that for some kids who are really sensitive to sounds, noise cancellation headphones can be really beneficial. Okay. However, they're not the easiest or most comfortable things to sleep with. So if your child sleeps on their back, this might be a possibility. But if they sleep on their side or on their stomach, this might be a little uncomfortable. In that case, I would do the Max earplugs. Now, for some kids who are really hypersensitive to sounds, but they're also really hypersensitive tactily, these things can drive them crazy. They may be very sensitive around their ears and around their face. So one thing you might have to do is you might actually have to soundproof your child's room in that case. So you can get noise absorbing panels, or you can even put on one wall of your child's room like the foam from a recording studio. You can actually buy panels of this online, and you would put this on the thinnest or the noisiest side of your child's room. Now, for kids who have poor hearing, I really don't recommend using white noise, okay? And that's simply just because you might be contributing to auditory chaos that might already be there for your child, all right? Now, some kids, they sleep really well with a white noise machine. If it's something you're already using, that's okay, but it's not something you necessarily have to introduce either. And I would say that if your child's really sensitive to sounds, try and steer clear from it.